Okay, welcome everyone. So right now we are going to look at most important topic, that is hypertension. And look at the topic, that is hypertension is defined as when systolic blood pressure is greater than 140 and diastolic is greater than 90. That condition is known as hypertension. Risk factors are age, obesity, diabetes, physical inactivity, excess salt intake, excess alcohol intake, family history, African American greater than Caucasians and Asians. So these are causative factors or risk factors for hypertension. Clinical features are 90% of hypertension is primary and related to increased cardiac output, increased TPR, and the total peripheral resistance is increased. Mostly 10% of the population involved renal and renovascular disease, fibromuscular dysplasia, and string in bead appearance with atherosclerosis and primary hyperaldosteronism can cause hypertension. Hypertensive urgency and hypertensive emergency are two different types. In hypertensive urgency, no end organ damage occur, while in hypertensive emergency there is severe hypertension with end organ damage like MI, heart failure and aortic dissection, kidney injury, microangiopathy, anemia, eclampsia. And predisposing factors are CAD, left ventricular heart disease, heart failure, atrial fibrillation, aortic dissection, aneurysm, stroke, kidney disorders, and retinopathy involved in hypertension. So, in this way, hypertension patient presents. Now, another topic is hyperlipidemia signs. Hyperlipidemia signs are xanthomas, tendinous xanthoma, and corneal arcus. As you can see, this cornea, there is arcus senilus and lipid deposition around cornea with aging appear process and hypercholesterolemia in arcus senilus patient. So in this way, these lipid deposition occurs in the patients. And the another disease is arteriosclerosis, means hardening of arteries, thickening of walls, loss of elasticity. Arteriosclerosis is common in small arteries, haline arteries, hypertension, diabetes, essential hypertension, diabetes, and hyperplastic onion skin lesions. Involvement in arteriosclerosis. Monkey bug medial calcific sclerosis is when the tunica media is involved, that is monkey bug medial arteriosclerosis is calcification of internal elastic lamina of media of arteries. That's why it is known as medial arterial sclerosis. Okay, so another disease is atherosclerosis. It is very common disease of elastic arteries, and large and medium muscular arteries are involved. And when atherosclerotic plaque builds up in the uh, arteries and vessels, that is known as atherosclerosis. Abdominal aorta, and then coronary artery is involved, then popliteal artery, and then coronary artery is involved in atherosclerosis. So risk factor for atherosclerosis development is modifiable risk factor like smoking, hypertension, hyperlipidemia. These can be modified, these can be changed, while non-modifiable risk factors include age, which is non-modifiable, sex and men more common in post-menopausal women, it is more common, or in family history, atherosclerosis is more common present.